Hi guys, for my second rotation, I was at Atchison Hospital, and so they had inpatient and outpatient, and then in inpatient they had acute care and then swing bed. And so I got to see a lot of different things, but not really a lot of different diagnoses. A lot of it was just they came in because they had stomach surgery or orthopedic surgeries or something like that. I was on the med surge floor, and so it was a lot of like they would have a surgery and then they'd come to our floor, and so we would just work on them with that. But with another class that I was in for my bachelor's degree, we talked about hospital readmissions, and so I kind of thought about I had that in my mind, and then I had this rotation in my mind, and so I kind of just put it together, and I decided to make handouts to explain what conditions are to the patients, like what their specific condition is, and then what occupational therapy can do for them. So the first handout I made was what occupational therapy is. And I thought this would be important to give to patients because a lot of them really honestly thought we were physical therapy. A lot of nurses even thought we were physical therapy. And so I think occupational therapy always just has to really explain what they are. And I think that having a handout for that is a little easier. And so you can just tell them like what we focus on and then activities of daily living, instrumental activities of daily living, and give a few examples of that. And so it's more clear. The first diagnosis I chose was COPD. I had one patient with COPD, and it really amazed me how low his endurance was. One of his goals was to make it to the bedroom sink to do grooming. And that just really shocked me that it could be that bad. And so I chose to do this one. It talks about what it is, the symptoms, and what complications are caused. And I can't figure out how to get the whole handout on the PowerPoint. And so I'll provide like each of these handouts, I'll put a link to them and put it in the comments so you guys can see the full handouts. But the next one would just talk about what we do with them. And then stroke prevention is what a healthy person does to prevent stroke, and then what someone who has pre-existing medical conditions can do to prevent stroke. And then the next part of it breaks down specifically interventions that we will do with patients to prevent stroke. And then diabetes, we saw a lot of patients on the floor that had diabetes. And so what it is, the complications and symptoms, and then what occupational therapy specifically does will be provided later. Traumatic brain injury. We had one patient who had had a traumatic brain injury previously, but we saw her an outpatient, and so we weren't seeing her for that. But she did have one, and she couldn't remember things very well, and so we had to write down everything for her. And so, but this talks about what it is, and then what it causes, and then specific interventions will be given later. And then pain management. We saw a lot of people for pain in outpatient. They would come in and have pain in their wrists or their hands or shoulders, and it was usually arthritis, but there's not really anything you can do for that. And so we would just be seeing them to alleviate some of their pain. And so this talks about what it is, what causes pain, and then it talks about specific interventions later in the handout. And so that would be like stretching, manual therapy, or massage. And then sometimes we did modalities. It just kind of depended on if they were getting any better or if the OTR thought they would get better with them. And then deep breathing techniques. This goes with a lot like the COPD and anyone with low endurance. We would talk about deep breathing with them. And so this was a handout for how to do that. And then pursed lip breathing was another one that we did with a lot of patients. And so I provided a handout for that. And then energy conservation was another one for low endurance. And really anyone who's getting to the age they are losing endurance, they can use this and be good. So I thought it would be a good one to provide. And I really liked this one because it talks about the 4 Ps. So prioritize, plan, pace, and position. And then it goes in specific ADLs for that. So there's one for dressing, one for shopping. Like it breaks them down and talks about how you can do these 4 things with those specific ADLs. And so I really liked that. And I thought it was a good one to provide. And then that was all the handouts that I made for them because it was hard because I didn't really know what ones to provide because I hadn't seen very many diagnoses, and they do have a lot of handouts at Atchison. I got to go through their folders of how many and like all the different ones they had, and they have a lot for outpatient. And so it was mainly just working with inpatient ones. And like I said, I didn't get to see very many different diagnoses. And so I just kind of made some of the common ones. And that is all I have for you. I will provide the full handouts in the comments or with this.